Hi, I'm Marvin Plackett, and today is Monday, June 22nd. Greetings to all residents, to all staff, and to all guests. I'm pleased to report that once again we have no new confirmed COVID-19 cases. And also, one of our staff members has fully recovered and is now back on duty. And that means that our count now is down to 5 active COVID cases. 2 are residents and 3 are staff. And those 2 residents, of course, are on our COVID-19 unit at Episcopal Church Home on 2nd floor. And we're delighted to have that one staff person back. We celebrate all of our successes. I mentioned on Friday that you now can see a dashboard of our COVID status on our website. Our website, of course, is episcopalhomes.org. And then right away, right at the top, it'll say COVID-19 updates. And then if you go to a spot a little bit on the right, it says COVID-19 case dashboard. COVID-19 case dashboard. And if you go there, and in fact what I did is I was just there 5 minutes ago, and I printed off what is showing up there. And so the first line is current active cases, and then there's 2 columns, residents and staff. And under residents it's 2, staff it's 3. And incidentally, this updates every single day and usually multiple times a day. Anytime one of our staff persons that's authorized to make updates puts in an update, that is recorded as, when it's last updated on the website. So it's basically, my point is, this dashboard is current. There's my point. So we have current active cases, and then there's total recovered, total deaths, total positive tests/cases, the percent that are positive, total tests administered, awaiting results, and then for the active cases, what is the location of those active cases? And for instance, here's a statistic that you would not necessarily have thought of. Total tests administered. For residents, we've administered already 231 tests. For staff, we've administered 404. And for residents, total positive cases, 15. That's out of there's not 15 now, there's only 2 right now. But since the beginning of COVID, 231 tests, 15 were positive. For staff, 404 were tested, 22 were positive. Again, only 3 remain active cases. But in total, from the beginning, going back 3+ months, it's 22. So anyway, in any case, this is a website that you may want to visit with some regularity. It's a very helpful, quick snapshot of COVID at Episcopal Homes from the beginning. Reminder that everyone will be tested at the gardens tomorrow and Wednesday. That will be for all residents and all staff. And then you may well have already seen directions from the administrators at Episcopal Church Home and the gardens pertaining to the gradual opening up of visitors to visit their loved ones at Episcopal Church Home and at the gardens. And just very shortly this afternoon, instructions are going to also be coming out from Iris Park Commons, our assisted living. And each one of those is a little different. The reason is because, of course, each facility has a little different layout, a little different design, and the health department is very specific about how the guidelines need to be implemented. And so since they are unique facilities, unique numbers of residents and staff, therefore their instructions had to be very specific. So be sure to read those instructions for those 3 if in fact you have loved ones that you want to be able to visit in person, because we all need to abide by the rules that have been laid out by the Minnesota Department of Health. I want to mention that once again there is a quarantine sing-along with Joey Clark tomorrow, June 23rd, 10 a.m. in the courtyard. So 10 a.m. in the courtyard, 10:45 in the parking lot, and 1 p.m. at Carty Heights. Lastly, just a reminder to be sure to stay safe, as in social distancing, staying at least 6 feet apart, wearing your masks at all times that you're not in your apartment or in your room, and If you feel any symptoms whatsoever, be sure to stay in, self-isolate, let the manager know, and then contact your healthcare provider to get tested. Fortunately, those that want to get tested these days, we can get tested. That's a very good thing. And then frequent washing of hands. So all those things added together, they go a long way towards keeping one another safe. You protect me, I protect you, we protect one another. Vital tactics that we must employ to remain safe. That's my report for today. I look forward to seeing you tomorrow at 1:30. Take care. Bye-bye.